Hello and welcome to today's presentation on African American women and obesity in South Carolina. My name is Nicole Sherrard. I am a registered and licensed dietitian. I completed my undergraduate degree and dietetic internship at the University of Prince Edward Island. The content of this work are for a project completed by myself, a student at the University of New England Master's Applied Nutrition Program. All works published by students are solely the responsibility of the student author, and viewer readers should be aware the work, statements made, and opinions expressed are strictly those of the authors and not the University of New England. This project was developed with the South Carolina Public Health Association in mind. Let's get started. An outline of today's topics will be an overview of obesity in the African American population, determinants and impacts of obesity, interventions, and conclusions. Data collected from the National Health and Nutritional Examination Survey from 2021 showed obesity in the United States affected 41.9% of the population, with the non-Hispanic Black adults accounting for 50% or more than any other race. In 2019, the annual cost of obesity and related conditions such as heart disease and type 2 diabetes was $173 billion. There are many key determinants and impacts of obesity among African American women. Today, we will be talking about geography, poverty, family commitments, followed by culture. African Americans are the third largest racial group in the United States, and approximately 90.4% who reside in southern states like South Carolina live in rural areas and make up 11.5% of this population. Rural African American residents are more likely than their white peers to live in a county without a hospital or home health agency, and 84% of counties they call home are considered health professional shortage areas. In 2015, 75.3% of rural African Americans lived in a county with an uninsured rate of 12.2% or more. This means getting access and coverage for adequate health care can be problematic. Those living in rural environments have a disproportionate burden of chronic disease relative to the general public. Mortality rates of the rural African Americans are greater than both white rural residents and urban dwelling African Americans. Physical inactivity is more common in ethnic minorities compared to Caucasians. African American women living in the South are 60% more likely to lead sedentary lifestyles. Females of all races have factors inhibiting exercise, such as lack of time and energy. However, research shows African American women are more likely to be without a safe place to exercise. In rural areas, sidewalks, street lighting, and other environmental factors may not be conducive to exercising outside. Additionally, exercise and recreational facilities do not often exist in rural areas, and transportation may not be available. The U.S. unemployment rate returned to a historic low of 3.5% in December. However, jobless rates for Black women still haven't recovered fully from the pandemic. Reasons we will be discussing include occupational segregation that crowds people of color into low-paying jobs and women's caregiving responsibilities within families. In the United States, 32% of women across the country earn less than $15 an hour. Women of color are disproportionately affected by low-wage jobs with little opportunity for growth. Among women of color, half make under $15 an hour. If you factor in raising a child, commuting to work, and a second job to make a living wage, there is no additional time in the day to exercise or have healthy meals. Many of these women live in a sandwich generation, which means that they care for a parent over the age of 65 while raising a child under 18 or else a grown child. African Americans are more likely to support parents financially compared to other races by 40%. Of single-parent homes, most are female. In South Carolina, 39% of children live in a single-parent home, which is on the higher end of statistics for the United States. Furthermore, 64% of African American children live in single-parent home, which is more than any other race. African American women are not as concerned with their weight compared to Caucasians. One study found that even though Black women had a higher body mass index than white women, they perceived their selves to be higher in attractiveness and lower in weight due to their preference for curvy body types. Soul food is composed of fried foods, fatty meats, and rich gravies, which originated during the times of slavery, when slave owners took the most nutritional food for themselves. Although this diet has contributed to obesity and health problems among African Americans, these recipes and eating styles are still passed through generations. African American rural residents lag behind white residents in educational attainment. About 20.7% of rural African Americans versus 10.4% of white adults have less than a high school diploma. The number of white women getting an associate or bachelor's degree by the age of 29 doubles that of Black women. It is not surprising, looking at all of the data that we just did, that 98.4% of low socioeconomic status Southern rural adults lack proper nutrition. Several interventions have been trialed within the African American population and will be described. African Americans living in the South are more likely to go to church than those living anywhere else in America. Due to their density and outreach, places of worship can reach many individuals and populations that may otherwise be underrepresented. The South Carolina Department of Health and Environmental Control promotes a program, Protect Your Body, Protect Your Temple, developed by the Office of Minority Health. Research has shown positive outcomes when healthy eating and exercising are incorporated into the church as a form of education through brochures or the implementation of toolkits by staff. Incorporating nutrition seminars into church has also been beneficial. The Supplemental Nutrition Assistance Program, or SNAP Ed toolkits, titled Faithful Families, Thriving Communities, have used the social ecological model to partner leaders of faith and trainers in nutrition and physical activity to relay curriculum, Eating Smart and Moving Together, which has 9 lessons. The program has predominantly been implemented and successful with low-income African American communities. For example, North Carolina, they saw an improvement in the use of nutrition facts to make food choices, plan meals ahead of time, shop with a grocery list, and prepare food without the use of salt. There is some research around outreach, which has shown family engagement and decreased stress levels with the delivery of healthy, low-cost food kits. Further research in this area, working within the community to have low-cost or subsidized meal kits delivery, would be beneficial. In conclusion, many variables at each level of the social ecological model impact and African American women's weight status. More longitudinal data would be warranted as short-term studies have been successful. Further research on outreach in the community, looking at, for example, the low-cost healthy meal boxes to specifically measure nutritional status would be beneficial. Thank you for watching.